Hello everyone, Dr. Ernesto Medina here, founder of the Berry Health and Wellness Center in San Jose, California. In this video, I want to expand a little bit more on the functional medicine approaches to mental health, focusing specifically on anxiety with some real practical cases that have come through my office. This is an area I've put a lot of effort and focus on because it's something I've struggled with for many years, and the longer I spend in the healthcare system, I find the majority of people suffer from some degree of debilitating anxiety in their lives. So I hope this helps. Some of the topics in here we covered in the first video. I recommend you watching that one before watching this video. That first one's called Functional Medicine Approach to Mental Health, because a lot of the topics we're going to talk about were covered a little more in depth in that video. Okay, so a quick overview on what we talked about in the last video. The major neurotransmitter known as GABA, right there in the middle, it tends to be one of the first ones we think about when we think about anxiety. GABA is a inhibitory neurotransmitter, meaning it actually shuts down the brain, lets us relax and calm down and sleep. And there's a couple ways GABA is made. One being glutamate, which is the primary excitatory chemical in the brain. It's converted into GABA. Having healthy blood sugar levels, so that is not too high and not too low of blood sugar. And having healthy progesterone levels, which for women is made in the ovaries, at least for cycling women, and for men and postmenopausal women in the adrenal glands. Now the other main one we're going to talk about is serotonin, which was also covered in the last video. And we have first our kind of precursors to making serotonin, being iron, vitamin B6, magnesium, calcium, zinc, and again, healthy blood sugar levels. And we have our cofactors there, and we have that conversion with the cofactors into serotonin. Serotonin is then converted into melatonin, which again is our sleep, regulates our sleep and sleep cycles. And then we have estrogen and the importance of healthy estrogen levels in healthy serotonin levels as well. So you can imagine many women are on birth control or hormone replacement, and so that's always a factor we have to evaluate in people dealing with anxiety or even depression or seasonal depression. Is, have they been on birth control? Are they on birth control? How long have they been on it? And how well is their system actually filtering it out? Because that can definitely affect mood and mood disorders. So a couple case studies. We're going to focus on 3 specific ones. So these 3 women came in to my office with chief complaints of, one being anxiety, bloating and abdominal distension, specifically to certain types of grains, wheats, and gluten. They all suffered from insomnia, so poor sleep or being able to fall asleep but waking at 2 or 3 in the morning consistently every night, and chronic neck and back pain. A little history on them. 2 of the 3 had a mild traumatic brain injury. In other words, they had an injury to the head, either, and from the most common way to suffer a injury to the head or a minor concussion, which is another way of saying MTBI, is to car accidents and whiplash injuries in a car accident. So 2 of the 3 had a history of MTBIs. 2 of the 3 reported having high stress jobs, and 1 of the 3 was actually perimenopausal. So she was a bit older and starting to have irregular cycles. Lab work on them, if we compare the 3, we did a pretty comprehensive blood workup on them all, and this is what we found. All had, well, as we finish here, we're going to compare kind of what was the common thing among all 3. And you can see here in red, all 3 had blood sugar issues. So I cannot stress the importance of having healthy blood sugar levels, both too high, like we see in number 3, or too low of blood pressure, like we see in 1 and 2, will affect our capacity to make healthy brain chemicals, especially GABA and serotonin, like we talked about at the beginning. All 3 had deficiencies in vitamin D, which tends to be the #1 deficiency in the United States. And all three also showed signs of leaky gut, so inflammation in the digestive tract, which was causing a systemic inflammatory response throughout the entire body. Now, on number 3, you notice on 1 and 2, we checked for omega-3 levels, so your omega-6 to omega-3 ratio, also called omega-3 index. In number 3, we didn't actually check that, but you can see 1 and 2 did have a deficiency in omega-3s, and I would bet money that number 3 did as well. All right, and there's lots of information out there on omega-3 and EPA and DHA, which are the active components in omega-3 fish oils, and their importance in brain health and neurological health. And 2 of the 3 were definitely deficient here. Now, the other thing we did in the office is we did some computerized dynamic posturography, and we did a pretty comprehensive neurological exam. The neurological exam we do in the office is basically designed to identify areas of the brain that are not working as efficiently as they should be. It's a functional test we do in the office, and it usually gives us quite a bit of information of what areas of the brain are likely not working as well as they could be working. And part of that neurological exam is the computerized dynamic posturography testing. And you can see here, this is an example of a report. And you can see we're going to expand a little bit more on this test in the next video called fall risk assessment. So be sure to check that out. But you can see here, we had all 3 of the women had clear deficiencies in a part of their brain called the vestibular system. And we're going to expand a little bit more here. They all tested pretty much in the lower 20th percentile, and you can see how low that is. If they had scored upper 80s, 90s, like you can see under the standard and vision sections, we would have considered that normal. But all 3 of them had major deficiencies in their vestibular system. So the vestibular system itself controls postural reflexes, eye movements in relation to head and body movements, and our spatial orientation, or our spatial understanding of where our body is kind of in our environment. But the vestibular system itself feeds into the anxiety centers, or the autonomic nervous system of the brain, and also feeds into spinal stabilizing muscles of the neck and back. And if you remember, one of the common chief complaints of all 3 women had was chronic neck and back pain. The ironic part was that 2 of the 3 women had been under either physical therapy or chiropractic care for a long time, and were still suffering from the chronic neck and back pain. But as you can see in the previous testing we did, their vestibular system was just not working the way it should be. And even though physical therapy and chiropractic adjustments are great, if that vestibular component isn't addressed, symptoms continue. Right? And the other symptom they were also experiencing was the anxiety, the chronic anxiety, which, unless you understand the neurological approach to this, wouldn't be linked to chronic neck and back pain, but they definitely are linked as they come from the same system. Right. So now, our intervention strategy we used was essentially multifactorial. We first addressed inflammation in the gut, put the women through a detox, a repair program for the intestinal lining, cleaned up their diet, eliminated high inflammatory foods so the gut could heal over time. We put them on some targeted supplements based on their lab reports to increase those values, including B vitamins, omega-3 fish oils, vitamin D, as well as a gut cleaning and a liver support. And then we gave them specific exercises to retrain their vestibular system. Now, the third woman, if you remember, she was perimenopausal, and hormone replacement could be a viable option for her. But we're going to attempt to address all the underlying factors first and see if things get better. And if not, that can always be an option we refer her out for. All right, and again, my name is Dr. Ernesto Medina, founder of the Bay Area Health and Wellness Center. We offer free 30-minute consultations. You can find our website there at the bottom, bayareahealthandwellness.com. Our Instagram tag at Dr.Ernesto_Medina_DC. Thank you. I hope you enjoyed the video. Check out our next one next time. Thanks.